Good evening, I'm Reggie Cox, and I believe most of you know that I'm nearing the end of my requirements for the Masters of Arts in Counseling program. Have 58 credits, and this class will take me to 60 credits, so I'm excited that we only have one more week to go, and I'm looking forward to the graduation on May 10th. As you know, I'm the only male in this class, so the topic that I chose for my literature review is men with eating disorders and the efficacy of therapy working with men. Based on my research, I was very intrigued with my findings that I would like to share with you at this time. First of all, eating disorders has been characterized as a condition affecting mostly women. However, over the past decade, the rate of men diagnosed with eating disorders have risen from 10% to 25%. And one of the reasons why the increase, a matter of fact, the actual figure could be much higher than 25%, given that eating disorders in males continue to be disregarded, understudied, and not reported. So the question is, why are the rate of men with eating disorders so disproportionately lower than females? Carol Costin, the author of the Eating Disorder Sourcebook, she asserts that, and I quote, "Until recently, men with eating disorders have been so rarely acknowledged or encountered that the diagnostic possibility of anorexia nervosa, bulimia nervosa, and even BED has often been overlooked when they present with symptoms that would lead to a correct diagnosis if seen in a woman." In other words, if a female were to undergo therapy and had certain symptoms of an eating disorder, then the therapist would be inclined to diagnose the female with an eating disorder. However, if a male had the same diagnosis, according to Carolyn Costin, the male would not be diagnosed with an eating disorder. And then the question is, why is that the case? And based on my research, I have found out that there are many treatment challenges and gender-specific issues that preclude men from seeking treatment and being properly diagnosed with having an eating disorder. What are some of the treatment challenges and gender-specific issues? I'm going to briefly talk about gender orientation, sexual orientation, athletic endeavors, depression and shame, and then immense media pressures. Let's look at gender orientation first. First of all, there's an enormous stigma that eating disorders are properly characterized as a female problem and not a male problem. Based on my research, it did inform me that eating disorders do affect more women than men. According to the National Institute for Clinical Excellence, they assert that approximately 1 in 250 females will experience an eating disorder. However, 1 in 2,000 males will experience the same. Even in our Diagnostic and Statistical Manual of Mental Disorders, one of the criteria of having an eating disorder is that a person with an eating disorder must display the absence of at least 3 consecutive menstrual cycles. This infers that anyone with an eating disorder has a female problem. And that's one of the challenges for men to self-report that they have an eating disorder, because they don't want to be characterized as being feminine. Also, in therapy sessions, in group therapy sessions, that is, women significantly outnumber their male counterparts. And as a result, based on my research, group therapy, the therapy sessions, the group sessions are primarily centered around female issues, which makes the male uncomfortable with being in that environment. And if they are in that environment, they won't stay in that environment. And so that's a problem with men completing therapy for an eating disorder. When you look at sexual orientation, eating disorders have significantly increased among the gay community. The figures say that it has increased 10 times more than heterosexual men. According to Eric Strouder, I quote, he says, concern over body shape and weight is prevalent among homosexual men and can become pathological, end quote. And so males are reluctant, or men are reluctant to, at least heterosexual men are reluctant to go forward and report that they have an eating disorder because they may be labeled as being homosexual. Even when you look at back in the late 80s, early 90s, our media projected an image of men who have lost a significant amount of weight as having AIDS or another sickness that was also associated with some type of gay behavior. And these factors combined causes men not to want to go forward as having an eating disorder. Third, shame and guilt. Depression and shame is common among men with eating disorders. In today's world, men are expected to hide their vulnerabilities, including depression and shame, which is associated with the stigma of being gay or feminine. And as a result, because men are not often willing to go below the surface, be vulnerable, be open, and discuss their issues in an environment amongst their women counterparts, then they may not go forward with having an eating disorder. Athletic endeavors, when you look at it, athletic endeavors, males are often misdiagnosed as having an eating disorder because, according to Carolyn Costin, males are often intensely athletic and thus are more likely to have begun dieting to attain greater sports performances, end quote. In other words, losing weight is a common practice for males participating in wrestling competitions, cross-country running activities, and other physical fitness sports, military. For someone who is overweight, may be found on the overweight program, remedial fitness program. All of these factors kind of give the males a sense that they're going to have to lose weight. And losing weight for men is culturally accepted to participate in sporting events and activities. So when a counselor is counseling a male, sometimes it is in his or her mind that the man is not does not have an eating disorder, but just maybe just working out and trying to lose weight to become a part of an athletic team. Although physical exercising may be culturally accepted for men, I am reminded of a scripture. It comes from 1 Timothy 4:8. It says, "For bodily exercise profiteth little, but godliness is profitable unto all things, having promise of the life that now is and of that which is to come." And what this scripture tells me is that, first of all, it doesn't discourage exercising, but rather it encourages people to focus more on their spiritual being and not on their physical nature. Media pressures also play a role in men wanting to lose weight in order to maintain an ideal masculine body. And because of media pressures, because of what is being displayed on the television, men are more inclined to want to be socially accepted amongst their peers, and therefore they're going to do everything they can to lose weight, to maintain an unrealistic, in some cases, body image. When you look at interventions, and I just want to close with interventions, as I began to look at the efficacy of therapy for treating men with eating disorders, I found out that therapy for men is consistent with therapy for women. However, the challenge is to get men in therapy. If we can get men in therapy, they tend to do well while in therapy. But the problem is that men have a tendency not to go forward with treatment. Men are reluctant to seek treatment because of how society views men with eating disorders. And I want to close by stating that in order to ensure effective treatment for males with eating disorders, the therapist must reassure heterosexual male patients that them being diagnosed with an eating disorder does not equate to them being gay or homosexual. Also, my readings showed me that as men go into therapy, that therapists must also be certain that the environment is not catered just for females. Magazines have to have men on the magazine covers with eating disorders and not just their female counterparts. Men have to feel welcome to be in those kind of environment. A lot of therapeutic sessions or techniques work, cognitive behavioral therapy, as well as rational emotive therapy, trying to get men to understand and to change their faulty thinking as far as how they view eating disorders. So the findings at the end of all of my studies is that there needs to be more studies on men with eating disorders in order to ensure that we have enough data. We have to get more men to come forward with their problems with eating, and we have to get men to elect to go into therapy and to complete therapy as well. So this concludes my literature review. I appreciate your comments, and I hope all of you had a happy Easter. God bless all of you.